All right, let's dive in. Today, we are putting on our detective hats because, long before any high-tech scans or fancy lab work, a doctor's investigation into heart disease starts with the most basic tools there are: their eyes, their ears, and a whole lot of really smart questions. It's all about piecing together clues that are, more often than not, hiding in plain sight.
So that brings us to the big question that's going to guide us through this whole explainer. What can a doctor really figure out about a patient's heart before they even reach for a stethoscope? Well, the answer, as you're about to see, is a shocking amount.
So, where does any good detective start? Well, the first, and maybe the most important step, is to interview the witness. And in the world of medicine, the patient is your star witness. Their story, what doctors call the anamnesis or patient history, holds all the initial, crucial clues.
Now, to get a really clear picture, the questioning is super structured. It's what's known as the disease anamnesis. So, first up, when did all this start? You got to establish a timeline, right? Then, what sets it off? Is it physical work, stress? This starts pointing to potential causes. Is it getting worse over time, or does it kind of come and go? How often are the bad days? And a big one, what have you already tried, and did any of it actually help? You're literally building a case file, one question at a time.
But look, the disease itself is only one piece of the puzzle. To get the full picture, the investigation has to zoom out to what we call the life anamnesis. Does heart disease run in the family? Could a past illness, something like rheumatism, have left some damage behind? What about lifestyle? Smoking, diet, are you active? Even things like stress at work can be a huge factor. Every single answer adds another crucial layer to the case.
Okay, so we've gathered all the verbal clues. Now our detective work shifts to pure observation. And the very first physical clue is something you might not even think of: how a patient is holding their own body. Believe me, every single position tells a story.
And what's so fascinating is how a patient's posture is often this instinctual, automatic response to a very specific problem. For instance, if a patient has to sit bolt upright, a position called orthopnea, it's a massive clue for severe left ventricular failure. Sitting up literally uses gravity to keep some blood in the lower body, which takes a load off the heart and lungs and makes it easier to breathe. On the flip side, someone lying completely flat might be in shock. That position helps get more blood flowing to the brain. And someone leaning forward, they could have pericarditis, which is fluid squeezing the heart. Leaning forward just gives the heart a little more room.
So, from the patient's overall posture, our investigation is about to zoom right in. We're going to narrow our focus to the face, because some of the most distinct signs of specific heart conditions are written right there for us to see.
Check this out. These are two classic examples. On the left, you've got mitral phases. You see this with a narrowed mitral valve. Notice the description. The person is generally pale, but there's a specific bluish tint on the cheeks, lips, and nose. Now compare that to corvisar faces on the right, which is a telltale sign of severe heart failure. Here, the face is thin, kind of pale bluish, but with a yellowish hue, and the mouth is often hanging open because the person is literally struggling for air. Two totally different faces, pointing to two totally different problems.
All right, let's pull the focus back out again, from just the face to the rest of the body. The final set of clues in this initial once-over comes from the skin and any signs of swelling. I mean, these are the body's big flashing neon signs that something's up with circulation.
It seems so simple, right? Just looking at someone's skin. But what does the color of a patient's skin really tell a doctor? Well, as we're about to see, it can be an incredibly powerful clue. The main color-coded clue we're looking for is something called cyanosis. That's the medical term for that bluish tint the skin gets when the blood just isn't carrying enough oxygen. It's a direct visual signal that there's a problem somewhere in the circulatory or respiratory system.
But here's the kicker. It's not just that the skin is bluish. The real detective work is in figuring out where that blue color is showing up. That location, it matters a lot.
See, the location helps us split it into two main types. If the blueness is just in the extremities, the hands, feet, fingertips, that's called peripheral cyanosis. This points to a local circulation problem, like a traffic jam in the small blood vessels. You often see it in early heart failure, and those limbs will feel cold to the touch. But if that bluish tint is widespread all over the body, that's central cyanosis. And that suggests a much bigger, more systemic issue, like a congenital heart defect or serious lung disease, where the blood is already low on oxygen the second it leaves the heart.
And it's not just about being blue. Extreme paleness could point to problems with the aortic valve. There's even a very specific coffee with milk skin tone that's a classic sign of infectious endocarditis, an infection on the heart valves. A blue patch on just one leg could be a local blood clot.
And then there's this thing called a Stokes collar, a bluish swelling of the head and neck that's caused when a major vein is being squeezed shut.
This brings us to the last major clue in our observational puzzle, edema. And that's just a fancy word for swelling. It's caused by excess fluid getting trapped in the body's tissues, and it is a classic hallmark sign of a heart that's really struggling to pump.
But just like we saw with cyanosis, not all swelling is the same. The type of swelling is everything. Swelling that comes from the heart, cardiac edema, usually shows up in the lower legs, and it gets worse throughout the day thanks to gravity. The skin over it often feels dense, cold, and looks bluish. Now that's totally different from local edema, which is just stuck in one area, maybe caused by something like a clot blocking a single vein in one leg.
So think about it. We went from the patient's own story to the way they sit, from the color of their face to the swelling in their feet. And by piecing all of these individual clues together, a surprisingly clear picture of what's going on starts to take shape. And the amazing part? This all happens just from careful, methodical observation before a single high-tech test has even been ordered.
Which really leaves us with a final thought, doesn't it? In this incredible modern age of MRI scans, sensors, and all sorts of lab tests, could it be that one of the most powerful diagnostic tools of all has always been, and still is, a doctor's trained and observant eyes? It's definitely something to think about. Thanks for joining me on this investigation.